The clinic where late comedienne Joan Rivers died under scrutiny. Health officials saying that doctors should have been paying closer attention to her vital signs and prevented her death. Hello everyone, I'm Dan Kleffler in New York. It's a scathing report by the Department of Health and Human Services that says the doctors took pictures of Joan Rivers when she was under sedation. So for more on the report, I want to bring in ABC's Aaron Katursky following the story for us. And Aaron, what exactly did this report say?
Well, this is a report from the Department of Health and Human Services, and at risk for Yorkville Endoscopy is its Medicare certification, and it would lose that certification by January 7th unless there is proof that the clinic has taken corrective steps. We just learned from the clinic in a statement that they have submitted a corrective plan of action. We're waiting to see if that's going to be approved, but there was a lot for them to improve on because the investigators who conducted this thorough review after the death of Joan Rivers back in September faulted the clinic for a number of missteps. One, a doctor, at the time, the chief of medical services for Yorkville Endoscopy, took a cell phone photo, held up a cell phone while Joan Rivers was sedated, took a picture of her and of an unauthorized surgeon that was allowed in to do a procedure on her without proper clearance. And so that was perhaps a final indignity for Joan Rivers. And at the same time, while they're taking pictures in the procedure room, the report said that they failed to notice Joan Rivers' deteriorating vital signs, something that Melissa Rivers' attorney said in a statement that she is just outraged by and disappointed, the statement said, by the multiple failings identified in the report.
What do we know then the exact cause of death?
Well, the exact cause of death was released by the medical examiner's office. She had a lack of oxygen in her blood. She had brain damage, and this all stemmed from these two procedures to treat acid reflux that she went into Yorkville Endoscopy for. And she went in there under that premise for acid reflux. She was also having some trouble with her voice, and anyone who watched Fashion Police or knew of her work in her last months knew that there was a deep rasp, and often she would lose her voice during the show. She wanted to get that treated, and her personal ENT, her ear, nose, and throat doctor, a woman by the name of Gwen Corrivan, ended up coming to the clinic the day she went in for her acid reflux procedure and performed a procedure on her throat. This was not authorized beforehand. Dr. Corrivan is not supposed to be working at the clinic because she is not part of that clinic's team, and yet she was allowed in, perform this while Rivers was sedated with propofol. And one of the other findings was the proper dose of propofol was never properly recorded by the anesthesiologist.
So do we know that this is all taking place then? The person that was involved with the cell phone pictures, was that Dr. Corrivan, do we know?
No, that's Dr. Lawrence Cohen, who was the medical director of Yorkville Endoscopy up until recently. He has since left the clinic or was fired, depending on whose interpretation you believe. But the clinic says that nobody involved with the direct care of Joan Rivers is still working at the clinic, which remains open at the moment, though is now under threat of losing its Medicare certification. But the report that comes out, despite that threat for the clinic, really is the fullest picture as to what happened. Joan Rivers was in that clinic for all of 45 minutes. Her vital signs before she went in for the procedure were all normal. At some point, though, there was that dramatic drop in her vital signs, something doctors, the report said, failed to notice, maybe because they were taking a cell phone picture of her and Dr. Corrivan at the time, and later she died at the hospital. The doctors were able to successfully resuscitate her. We know paramedics were called. They were there in pretty short order, and she later died at the hospital.
What do we know then about the punishment that's going up against this center? I mean, I understand that it is still open, but what kind of violations are in place?
Well, they could lose their Medicare certification. So if they want federal money for procedures covered by Medicare and Medicaid, they're going to have to fix a lot of things. And the clinic says it has submitted a corrective plan of action. More broadly, though, and I think probably more significantly for the clinic, is it may face a lawsuit by Melissa Rivers. She has hired a pretty well-known and well-established firm, personal injury firm here in New York. Those lawyers said they are now investigating the death on her behalf. She may yet decide to sue the clinic.
All right, ABC's Aaron Katursky following the very latest on that report. Aaron, thank you. So for more, I want to go to our medical contributor, Dr. Mark Abdelmalik. And Dr. Abdelmalik, one of the drugs in question here is propofol. Of course, very familiar to a lot of people because it's the same drug involved in the death of Michael Jackson. There seems to be a discrepancy, though, about the dosage.
That's right. So the drug in question is propofol. This is an anesthetic that a lot of people are given every day, millions of people who are having surgery. It is used to sedate people so that exams can be performed. The question here is exactly how much propofol Joan Rivers got. The report today outlines that she was given 300 milligrams in the beginning. Later on, 5 hours after she coded, the staff at the center went back and adjusted the medication dose down to less than half of that, 120 milligrams, citing that there was a clerical error in the electronic medical record and they really didn't give that higher dose. So we really are unclear about exactly how much she got. What we do know is that just 7 minutes after she was given that powerful anesthetic, she was coding and her heart had stopped or went into an irregular rhythm.
We're also hearing that her personal physician, her ear, nose, and throat specialist was in the room during the procedure. Is that common practice?
So here's what we see that's consistent in Joan Rivers' now unfortunate passing and Michael Jackson's unfortunate passing is that these people are celebrities. They get VIP treatment. And with the practice of medicine, everybody should be treated as a VIP. And so bringing in your own doctor to a facility where that doctor is not licensed, accredited, is not within the realm of normal ways of practicing medicine. You know, that doctor is certainly probably qualified to do all of these procedures, but by that doctor coming in, it threw the staff off probably. This is somebody new in the mix. It changes the flow. You know, with surgery and procedures, everything happens in an orderly fashion, and adding a new person in the mix on very short notice really doesn't bode well for anybody, and clearly didn't bode well for Joan Rivers in this case.
It seems that Joan Rivers also had a nasal exam that was performed that she had not given written consent, in fact, to have done. Is there any way, in fact, that a physician, if it is a private physician working under her care there, would have had any kind of a blanket agreement or permission to perform something like that?
Well, there was probably a verbal agreement. Again, it was probably at Joan Rivers' request. We don't know the details of that. But what happened was she was most likely saying she was going in for a procedure to look at her reflux problem. And while she was at it, why not look at the nose and throat and voice issues that she was having? So there was certainly a verbal agreement, and she knew that she was going to have this procedure. But again, because they went outside of the proper protocols of documenting and informed consent with written papers, those steps were missed. And again, if she had went through the proper protocols, you know, we don't know that the outcome would have been any different, but it certainly would have given us a little bit of ease, and it would not have given many of these citations and violations at this facility.
And speaking of violations, clearly an ethical violation by snapping some kind of a photo inside of a doctor's office, a medical office, but it's also a violation of HIPAA laws, right?
So if that photograph was shared with anybody, certainly right away that would be a violation of HIPAA law. So even other people in the facility who, let's say, were in the next room over, if you showed that picture to those staff members, that is a violation of HIPAA. You know, having the documentation of a photograph for a non-medical reason, again, this was probably just because of who she was.
A very, very tragic story. All right. ABC's medical contributor, Dr. Mark Abdelmalek. Dr. Abdelmalek, thank you so much. You can keep up with this story in real time by downloading the ABC News app and starring the story for exclusive updates on the go. For now, I'm Dan Kleffler in New York.